if you give the brain what it needs to repair itself, and that's BDNF, remember brain-derived neurotrophic factor, the factor that causes brain repair in the adult brain. You deliver that by giving them ketamine or by giving them multi-watt infrared light therapy, because the infrared light therapy turns on the mitochondria, which turns on BDNF.
There are specific wisps of light that penetrate the dermis, the epidermis, and the bone. It's red to near infrared.
Certain wavelengths of infrared light are absorbed by the mitochondria.
Those are the little factories within those cellular structures that generate ATP. ATP is the fuel that your brain uses to run. That's what it's the fuel for those cells. So we're using natural clean light to fuel up those mitochondria that kick out a bunch more ATP.
With the right wavelength and with enough power to get through the scalp and the skull and into the brain, we deliver that wavelength to the mitochondria, and that turns on a bunch of things. Number one, it increases activity of the mitochondria, so you get more energy. More energy is good.
It increases nitric oxide within the cellular structure. That gives rise to increased blood flow. And when you get increased blood flow, you get a reduction of inflammation because the vascular system will carry out free radicals and reduce the trash in the brain, which is good.
But more importantly, the mitochondria send messages to the DNA saying, turn on these genes. We want these genes active. And what are those genes? Those are the genes responsible for making brain-derived neurotrophic factor, that growth factor that repairs the brain. It turns on anti-inflammatory chemicals that reduces the inflammation in the brain. It turns on chemicals that interrupts that glutamate storm, that overactivity storm. You know, so we've talked about there's 30 some odd chemicals that are turned on in the brain in PTSD. This is putting the brakes on a lot of that.
It's warm, the wand is smooth. Sometimes I ask for the lights to get turned off. Sometimes we play music, and it's completely relaxing.
In sort of a classic treatment modality, we would be treating the frontal cortex. So the frontal cortex is easily accessible here by treating the forehead. And then we get into the temporal lobe, and we can also get in behind and get at the hippocampus. So the hippocampus is the part of the brain in the temporal lobe that's sort of far back on the temporal lobe. So the easiest place to access is behind the ear.
Once I started the treatment, I started getting my life back. It took time, it took several sessions, but I feel like myself again.
Since he started the laser therapy, I noticed that he is not as tired. It used to be that he would have days and days and days of fatigue.
And as the treatments continued with the laser, I found less and less night terrors.
What I'm showing here are a number of symptoms and that we've seen with our patients, and we sort of track these symptoms and see how they respond. And so the red bars is before treatment. You see, almost all of our patients came in with depression and irritability and sleep issues. All of these get better.
The treatment itself is incredible. I would definitely recommend it to other first responders.
It was really life-changing for him.
First responders have more options available to them now with this type of technology. It can certainly reduce the symptoms that you're experiencing considerably and bring a great deal of relief.